Hi there, welcome to Physical Embodiment Studio. My name is Arian Soltero and I'm a brain-based trainer. What is brain-based training? Essentially what that is we use the visual system, the vestibular system, and the proprioceptive, which is the way that we feel in connection with our limbs, to assess and build upon a foundation. So the steps that we take in a brain-based lens are to essentially connect, like a GPS system would, coordinates from our eyes, inner ear, right, which is the way we kind of balance when we move our head and ears, and our body for the sensory that we receive from the world around us. So when we're touching the floor with our feet, when we're either having bands, holding weights, all of that is information, that is all input that we receive, and we make a choice based on processing what the output is going to be, whether it's a movement output, pain is an output, fatigue is an output. So these are various outputs that the body chooses, like an opinion of the body, to express whatever the information, or process whatever the information that's coming in. When we're looking at the vestibular system, we want to consider these ocular reflexes, right? The eyes that stabilize with the inner ear, meaning when I'm tracking something or my head and my eyes are moving together, right? We have VOR, right? Or vestibular ocular reflex. And when I cancel these, essentially when my eyes stay still, but my head moves, we have a little bit of a cancellation of that vestibular ocular reflex. So we're gonna do both. So to start, all we're going to do is move our head side to side. We're going to rotate 10 times, almost like you are taking in a wide view. You're looking across, you're trying to keep that span across, and you could use the thumb, right? We could always do this. Same way we did the visual movements. We can get 10 repetitions, 5 each side, tracking something, right? Like a thumb, pen, pencil, or just the wall. 10 times. Then we're going to move up and down, eyes included. Down and up. Once I get about 5 to 10 reps, now that I move the eyes and head up, move the eyes and head down, left and right, we're going to try to add a tilting, right? So we're going to move the head side to side, keeping the eyes forward. And again, you can use your thumb to track 10 times. And like we mentioned, that is one reflex, right? One side of the vestibular system is to track eyes and head movement together. We're going to now separate those by moving the head to the right, but the eyes are going to stay glued to my thumb. So this is where, when we're looking at the visual field, and we talked earlier about one eye not being able to see the target because it meets the bridge of my nose, we're going to stop right before that opposite, or that far eye, the eye that's further away from the target, before it loses that sight, because we want both eyes to be able to track this in this case. So we're going to move the head as far to the right as I can. I can see the target with both eyes. I didn't lose it with my hind side or my rear side. And then I'm going to move the head right back to the midline. Again, it's not a lot of movement. We're going to move slightly to the right. I'm still seeing the target with my eyes. I didn't move my eyes with the head. And then I'm going to come straight back to the midline. Once we get about 3 to 5 of these repetitions, we're going to now move to the other side. And you can switch thumbs if your shoulder gets tired. It doesn't really matter which thumb you use. Just think about, again, fatigue. Fatigue matters, right? So if something is very fatiguing as you're doing it, you're probably not going to be doing it very well. So I'm going to switch shoulders just so that I can give my other shoulder a little bit of a break. And we're bringing the thumb out in front of me, or the midline, in front of the chin. We're going to move the head over to the left. I'm still tracking the thumb or the nail with my eyes and then bringing it back. Again, as far to the left as I can go, that's about as far as I can go, right? You might be able to go a little further. And then you're moving right back to the midline. We'll try to get 3 to 5 reps because we don't want to overdo anything. We don't want to supply too much of a dosage, especially if it's something we haven't been doing too frequently or recently. So now that we moved our eyes and head together, up, down, side to side, we also moved our eyes, right, separate from our head. So the head was moving, the eyes stayed still. We're also going to go up and down with this as well. So I'm going to bring my other shoulder out in front of me. I'm going to move my head as far up as I can. Notice how my eyes are still looking down at the thumb. And then I'm going to come back to the midline. I'm going to move as far up as I can go, right before I lose that visual, and then I'm going to bring it right back. We'll do one more rep. Again, 3 to 5 is the range we're kind of looking for here. You can obviously add a couple more. And then right back. And then we're going to switch and go down towards the floor now. So now we're going to switch arms just to give my shoulder a little break. We're going to move the head towards the floor, but notice how my eyes now are looking up at the thumb. So towards the eyebrows, trying to relax the eyebrows a little bit, and then reset and do it again. Moving the head down, but looking forward, chin down, eyes forward, or up towards the thumb, and then reset. And notice how I pause. You can pause for maybe 1 count up to 3 counts, so you can make sure you're stabilizing that visual before you're moving back to the midline. Down, and then reset. So now that I've done 3 reps, every direction, up, down, side to side, I also did the separation, right? The VORC, right? Which is my eyes independent from the head, right? Or separate from the head movement. We're now going to move back into our flexibility assessment and see, did that make a difference? Did that change me for better or worse? Or does it give me information about what I just did? So we're going to start again with the feet shoulder width apart or hip width apart, wherever we originally did it. We want the assessments to be as similar to the first time that we did as possible, so we can recreate and see, is the measurement changing, right? So we're going to move as far to the right. So that improved tremendously for me right after doing the vestibular. And then we're going to move as far to the left. I got a little bit more range of motion from that as well. So that tells me for visual, right, versus vestibular, maybe I was benefiting a little bit more from vestibular movements versus the visual movements. If my body or my flexibility got better instantaneously, it can tell me that that is maybe a positive stimulus, right, or stimuli on my nervous system. So now I'll do the same assessments, right, following in order. We did our bending over or hip hinge, right, and that actually feels a lot better as well. I'm rather flexible, right, and you might be as well, depending on how often you do this movement or how flexible your hamstrings are, but also pay attention to the ease as you go down there. Are you forcing yourself down? If you can touch your toes every time, is it kind of a challenge one time versus a little bit more of a falling over versus a stretching or creating or forcing, okay? So think about it in the ease, in the motion. That feels a little better for me. And then we're going to test as well the shoulder, right? We got the overhead. We also have the abduction. So these feel actually a little better as well, right? I got a little bit more range of motion there. Definitely, I feel that. And then we're going to go over the head. That feels good. I know my right side was feeling a little bit better than my left. So let's test the left. So we're moving up. That feels a little better as well. And then abduction. Perfect. And again, these assessments are just a few of many. You could test maybe flexibility of your wrist, right? If the wrist is something that you like to measure because you have tighter wrist or it's an area that you're concerned about, you could do a flexibility assessment for your neck. Any joint that we went through in the mobility segment or the motor control segment can also be used as a tool to reassess. You can also use strength as an assessment, right? So there are a lot of ways to measure progress beyond the aesthetic, right? And we're trying to focus on a feeling versus what we see necessarily. So we're thinking about what is unseen, right? What is internal to us, or the internal system, and the inputs, the information that we're getting from all of this.